That's what I was saying.
It's time for your inspection.
I'll write down a link.
Link me.
Link me.
Yeah.
Okay, so you should be able to see. So if you can't see, find a spot. If you're in the front, Stanley, maybe scooch down.
Especially if you're really tall.
I'm not tall at all.
Yeah.
I'm short.
Cool. Okay, so first thing we're going to do, we're going to cover and protect our trays. So in a dissecting tray, so all the equipment's at the back, so when you go to do yours, this is wax, okay? It's not some crazy substance, it's just wax. And so when we put our pins in, they're just going to sink into the wax. When you pull them out, they're going to be covered in black at the end. It doesn't mean that it's dirty, it just means it's covered in wax. Okay, so when you grab your pins, like, oh, look how dirty they are! No, it's just wax, it's fine. Okay, so we lay a paper towel down first, because some of our organisms that we're going to be dissecting are quite gungy. In other words, there's lots of like liquidy grossness in there. So having a piece of paper towel down helps with absorption of that, and it keeps the liquid at bay. Okay. So paper towel's down, we're good to go. Other equipment that you'll need, you're going to need a pair of forceps, okay, dissecting forceps. Okay, they're not called tweezers, dissecting forceps. You're going to need a pair of scissors, still called scissors, and you're going to need a scalpel and a probe. And there's a blunt probe and a fine probe. Either or works. I like the fine probe, but that's just me. But either or, you need some of the above, all of the above. There they are. These are your dissecting pins. There's a whole whack back there, so when you get started, just grab a bunch. Okay, so for the Ascaris, we'll take a look at the different types. So this is an example of a male Ascaris.
Is this living?
Nope.
Warming around.
You can tell it's male because of the hooked end. Do you see how hooked that is?
Pretty good.
Get the
Hooked
zoom.
end. Zoom in. Ooh. Yeah, so there's the hooked end, which makes it male. And I don't know, we have a female in here. And then this is the female. Notice it's longer. And no hook at the end. Yeah? So if on a test, hint, 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 if I had pictures of the two ends, you could tell me which one was male, which one was female, just based on the ends. Male is hooked, female isn't. Or based on size, the male is smaller and the female is larger. So we're going to put the male back. Done with that. Okay, and we are going to dissect the female. So if you want, you can just throw those on the thing back there. Let's get them out of the way. Okay, so when you have your specimen, before we do any sort of cutting, we have to do an external analysis, the outside. So take a look. Lots of times it's important to feel. If you feel, especially if there's any sort of grippers on the outside of the worm, which you'll notice with your annelids next class, you'll feel them almost pulling at your gloves a little bit, and so you can feel if there's anything there. So these worms are completely smooth, very much round, not flat, and large. So you can kind of compare the ends, if there's anything special or different. I'm looking at which sides, the anterior and posterior. There we go, like this. And so to start our dissection, we're going to secure the specimen down to the faucet, or down to the tray.
That's the worst part.
Securing the specimen is the worst part.
Obviously.
Okay, so specimen secure. I'm now going to take my scalpel, and I'm going to cut all the way down from one end to the other. Now, I'm not going to go like, ha! And like that, okay? I'm going to be gentle. I want to go just through the top layer of skin. So the best way to use your scalpel is to go very slowly and very softly through. And as you see the skin start to cut, you'll see, okay, I'm through the first layer, through the second layer, whatever I need to get through, okay? But if you go through hard right away, you're going to cut your worm in half and you're going to miss everything. Okay, so very gentle. You can see I'm already through the first little bit. Nasty. Okay, so as I go, I'm going to pin open the skin. Now, a couple of things about pinning. Notice how my pin is off to the side. It's not vertically straight up. And the reason it's off to the side is so I can see what's happening inside. If my pin was straight up and down, I wouldn't be able to see anything, right? So I'm pinning, horizontally. Okay, I'm going to continue to cut. open. So it looks inside like there's more squiggly noodles in there. Highly scientific term of wiggly squiggly. And I'm just going through the outermost layer. I'm not trying to go all the way through the worm, like I said before. So you'll notice I'm just peeling and pinning the skin back, right? And by just pinning the skin back, I'm exposing everything inside. And it's literally like there's a bunch of stuff, looks like noodles, sitting inside the body skin. There's nothing holding it together. There's no muscle between the two. There's just like an open cavity. Do we all see that? That's the pseudocoelom. All this open space here, that's the pseudocoelom.
How does it move?
How does it move? There's muscles, and if you look really closely, we'll get like the hand lens that was here earlier. There's muscles, these muscles here, they run vertically up and down, so the worm can squish kind of side to side, and that's what allows it to wiggle and squiggle.
And it has nerves in there and stuff?
Not a ton of nerves. This is a parasitic worm, so just like all our other parasites, it doesn't need to be able to detect its environment because it's living internally. If it was an external or a free-living one, then it would have to detect its environment, find food, watch for predators, that kind of thing. But when it's living internally, it doesn't need that. So it appears degenerative, but it's not actually degenerative. Right. So keeping your eye out, we're looking for the intestine. If you've seen the intestine yet. I've seen the intestine. I don't know about you guys.
Get a close up on that.
I will.
On that cut. That incision.
The ankle shots. Get some like filters on here.
Filters. It's like a really hipster video.
It's like hipstergram it.
I can find it now.
Hipster like bio video.
People are into that these days.
Really?
Hipster bio videos.
Hashtag hip.
Wait, where did they get these worms? Do they breed them or?
Yes and no.
It didn't come from somebody today.
No, they wouldn't send you something that's lived inside somebody else for the risk of contamination of getting sick and that kind of stuff. They do, for the most part, breed all the stuff that we deal with. So any of the specimens that we bring in, for whatever reason, are all grown especially for this.
Yeah, grown and harvested.
Okay, so let's talk about the insides now. So all this really fine kind of stuff all through here, do you see all the fine? The fines, yeah, the fine noodles. All of that is reproductive. Okay, there's a thicker one that we can kind of see here. It's already starting to dry out, and then it comes back down here, and it kind of runs in between all of this stuff here. So I was able to pull. Oh, there it is underneath. These little layers off the end. You can see the thicker one right here, and that's the thicker one there. That's the intestine. So this is the reproductive and intestine. That's all that's in there. No, there's no like liver, kidneys. There's none of that stuff. There's literally like an intestine for the entire way down and reproductiveness, and that's it. Right? Surrounded by a pseudocoelom, and I want to actually scoot some of the stuff out of the way. So you can kind of see, running along the back, there's that line that's running along the back there. Do you see that? That's the lateral line.
Oh. So does he have like a brain, or is it kind of like... No. It's not like the other worm?
No, there's not like a nerve ladder running up to the brain. There's none of that stuff.
He usually doesn't need a...
No. Nope. And then there's the muscles that run alongside. So this, on the outside, would be the ectoderm. The mesoderm's on the inside. The intestine that's running down here would be the endoderm, and the space between them would be the pseudocoelom. Sound good? Okay. So your job, amongst drawing all of that stuff, is to draw this as well. Okay, so a few things. You can draw the pins if you'd like. People sometimes prefer to draw without the pins, but just a note, look how the pins are way off to the side. When you start pinning, your pins are going to be straight up and down. It happens all the time. And I'm going to walk by and go, and like squish them all off to the side and push them out so you can actually see what you're dissecting in the middle. Okay? And that's it. That's all for dissecting. When you're done, you do have to clean all your equipment. So the pins need to be washed, the forceps, anything that you use to touch the organism needs to be cleaned as well. And last but not least, about your gloves, easiest way to take them off, over the top, hold onto it, over the top again, and it's all in one.
Ooh.
And you don't get dirty.
How
Okay?
useful.
And that's it.